Hello, everyone. My name is Junxiang Shi, Associate Professor of Biomedical Engineering at UMass Lowell. My pleasure today to introduce my work in nasal spray modeling in human nose, include both adults and children. The outline of this talk. First, I will talk about the nasal spray application and challenges. And second, the method to quantify and model sprays. Then an example to simulate the needle spray in human nose, which includes droplets deposition, film formation, and translocation, and followed by the needle spray in children. The first application may be related with the COVID because the virus will first deposit in the nose, specifically in the nasopharynx, where there is the one kind of protein, ACE2, can help the virus to bind into the cell and enter the cell. And consider the low vaccination still today in the world, especially in the developing world. Using the nasal spray to apply vaccination or COVID medicine may be a good choice. And the second application may be related with nose-to-brain drug delivery. And we know that there is more than 600 different types of the brain disorder, which not only in elderly, but also in children and in different genders. And there are many. So, but surprisingly, only one brain disorder using needle spray, that's the migraine. There's still 600 brain disorder, that is, we do not use that. Why? Because there are some challenges in needle spray. The largest challenge is that the low doses or the low drug delivery efficiency that can reach the turbinate, or like in the nasopharynx or olfactory region. The reason is that the high speed and the large droplet size of the sprays. Another challenge is that the human nose geometry is very complex. And to make things worse, at a different age, the nose shape and the nose volume can be very different, as shown here. So the second section, in this section, I will talk about the method to quantify and model the nasal spray, the spray releasing and deposition. First, we're using PIV to quantify the existing velocity, which we found that is close to about 15 to 18 meters per second. This is the model we developed that can simulate the Pauli dispersed size distribution with different plumb angle. And here is the simulation using a Eulerian wall film model. One thing we need to make sure is that the droplets, how thick can it stick on the wall? And of course, that's what depends on viscosity and surface tension. And what we did is we're using a tissue and then using two different solutions with the different viscosity and surface tension and try to compare their final stage. And this example, we found that the result agrees very well between the experiment and the simulation. Now we're using this model to study using the spray onto the wall. And we studied the effect of viscosity and surface tension and found that this model is quite sensitive to these two parameters. Then with this model, we simulate try to using the needle spray to deliver drugs to the olfactory region. And the patient will take a position of called vertex to the floor, bending head so that the liquid film can move or driven by the gravity. So before we do that is that we first optimize the delivery parameter. We study the effect of plumb angle, the nozzle orientation, and also the insert location into the nose. So the first one shows the baseline. We start from the plumb angle is 45 degree and the nozzle angle is 60 degree, which is recommended by literature. This one shows the effect of nozzle insert location. We start 7 locations, which at different location of the nose and with different depths. And we found that one location that is best than the other is that we put the nozzle at the base or at the back of the nostril and insert by 4 millimeter. And then we study the nozzle orientation, which include from 0 degree, that's vertical, then to 90 degree. And we found that 45 is better or is the best among these angles. This one shows the effect of plumb angle. Because we try to deliver drugs to the olfactory reading, specifically in this sample, the narrower plumb angle will deliver better dose to the olfactory reading because it can penetrate better. So with this, we decide the best delivery parameters, which shown here. And with this parameter, and we simulate the droplet deposition. And after that is using the wall film model, we studied apply different doses. For example, from 0.2 millimeter to 0.8 millimeter, how's the liquid film distribution they are. So for example, in the 0.2 millimeter, we do not find too much liquid translocation. The reason is that the tissue can hold all this liquid and they cannot, because of surface, either surface tension or viscosity, they do not move to other parts. In another way, the tissue can hold this liquid film. But if we increase to 0.4 millimeter, we found that the liquid film, they translocated to other regions. And 0.6 millimeter, they move to the translocation is more serious. And 0.8, we found that is because of gravity, some liquid already moving to the olfactory reading. The figure B shows the doses for the doses in different readings in the nose if we apply the different quantity of the drug. And C shows the deposition fraction. As we mentioned before, here the nasopharynx is related to COVID, and the olfactory reading is more relevant to nasal drug delivery. Depend on the usage, and we can quantify, and also we can optimize the delivery to the specific reading. This is to compare with the baseline because we have optimized the delivery, we have the baseline, and we found that the table here shows the initial dose and also the dose with the liquid film migration. We found that for the baseline, for example, consider the liquid translocation, the olfactory dose can increase 9 times, suppose from 0.15% to 1.3%. But with the optimized delivery, the film translocation, they can increase the olfactory reading from 0.7% to 6%. So 6% to olfactory reading is very significant. And also the front nose can be very different between the baseline and optimized one. So for the baseline, it can be about 4%. And for the optimized one, it can be less than 1%. This one shows the example that we deliver the nasal spray into a 10-day nose model. So here shows that's the 0.25 milliliter. We can say that because the small surface area of the nose, it cannot hold it cannot hold even 0.25. So the liquid will dripping down along the direction of the gravity. So the 2.5 and 0.25 millimeter and 0.35 millimeter, we see the liquid, they can even reach the throat, which can irritate the children, the infant, and cause coughing or crying. A quick summary, we developed a needle spray dosimetry model, and then we partially validate that using experiments. The droplet deposition is highly sensitive to the spray plumb angle and nozzle orientation. And liquid film translocation can significantly increase the olfactory dosage. And in this study, it increased 9 times. And children need much less dose to have a liquid film translocation. Otherwise, it can cause dripping and can irritate the children. And here is all about my result. I will be very happy to answer questions you have. Thank you.